সেখানে চলে গেছি। পেনটা কোথায় গেল?
কি পেন? সেটা পেন চা দিয়ে লেখ। আমার পেনটা দেখ না, ব্যাগে রয়েছে। আমার পেনটা ব্যাগে রয়েছে, দেখ কতক্ষণ ইয়ে করিস।
Visualize this, right? Right?
ঠিক আছে, ভালো লাগবে।
এটা পজ করে দাও।
Everybody has done? So normally the radiology contains X-rays, CT scans and MRI scans, is it or not? Everybody would have seen something. So we are concerned with the radiology of superior extremity today, right? Okay. What is the use of this radiology? Anybody? What's the use of this radiology?
To check the fracture.
Checking fractures.
Check fractures.
Fractures of bone.
Fractures, okay. Any other? So let's start. To see the bones. Any other? To identify solid structures, okay. Any other? Any deformity? Very good. Okay, fine. So, okay, to some extent, of course. With the X-rays, not that much, but with CT scan and MRI scan, yeah, absolutely. Okay. So, we use the radiology in the entire human body to diagnose, first of all, as you said, to diagnose identify the fractures. Fracture means it's a discontinuity of the cortex of the bone. Is it not? It's a discontinuity. For example, there is an ulcer on the skin, it's a discontinuity of the normal epithelium. The same manner, if there is a discontinuity, if there is any discontinuity in the surface of the bone, it is nothing with the fracture, right? Okay. So, in case of superior extremity and inferior extremity and in head and neck also, we will be using the X-rays to identify the fractures. Okay. But in case of thorax and case of abdomen, happens sometimes, right? So normal case of abdomen and thorax, we will be visualizing the other organs, whether if there is any fluid collection or if there is any air entrapment. Just for example, if there is any bowel injury, that means intestinal injury, the intestines contains air, is it not? So that will be leaked into the abdominal cavity. Okay. So to identify, if you could able to identify the air under the diaphragm, that means that indicates any hollow viscus is perforated. Okay. In the same manner, the other areas also. Like in case of abdomen, the air, and in case of thorax, there will be collection of fluid in the pleural sacs. Okay, for that sake, and for air entrapment also in the pleural sacs. So that to diagnose all those things, we'll be using the radiology. Okay, that means it will be giving indirect diagnosis what is happening inside the body. Okay, not the absolute diagnosis, indirect diagnosis. Okay. So, first of all, in case of radiology, we're concerned with the X-rays, not the CT scans or MRI scans. Okay. So X-rays. So X-ray, the color differentiation for each and every structure within the X-ray is in this manner. For example, the X-rays will be thrown in this manner, is it not? Anybody who has gone through the X-rays, right? So X-rays will be thrown from one side and those will be carried to the opposite side and the image will be displayed. Is it not? On the X-ray plates. Okay. Imagine when you are flashing a light on something, so at that particular level, the light will be cut off and the rest of the area, the light will be flashed onto the back side. Is it all right? So the shadow will be displayed on the back as a whole, right? The same manner, based on the absorption of the X-rays by different structures, the image will be displayed on the X-ray plate. How, for example, our bones are the solid structures because of the content of the calcium and of course phosphorus and other components will be present, mainly the calcium, right? So the calcium actually absorbs the X-rays. Okay, whenever the X-rays are thrown over here, okay, focused over here, the X-rays will be absorbed or will not be carried to the back side. So that's why the bone as a shadow will be visible on the X-ray plate. Getting it out? So imagine the shadow as the bone over here. Okay. But the other structures are in the form of liquid. For example, the fat, because of our body temperature, it will be in the liquid form, not solidified form. Right? And the blood, and of course the air and the fluid levels in the intestines. If you drink any water, all those things will be displayed on the X-ray plate. Okay, with different colors. So what are the different colors? The bones will be whitish in color because it will be absorbing the X-rays. Getting it out? Most of the X-rays will be absorbed, so X-rays will not pass on the back side. So the entire bone will be visible as whitish shadow over the X-ray plate. Okay. For example, if you take the fat, what would have happened over there? The X-rays are thrown over the fat. How the image will be displayed? If it is passing through the fat, for example, so how the fat will be seen over the X-ray plate? Which color it might be?
Black.
Not black, it's grayish. Because fat is a bit oily, so it will be trapping few X-rays and releasing few X-rays on the back side. So fat will be grayish in color, and the skin also will be in grayish in color, absolutely. And other muscles will be in case of muscles, it will be again grayish in color because those are not solid structures. Those are soft structures. Is it not? Right. So all the soft structures, to be frank, all the soft structures will be appearing grayish in color, and the solid structures will be appearing whitish in color. Getting it out? So this color differentiation you should understand. So if you take the air, lungs is filled with the air. Is it not? So what color the lungs will be giving to the X-ray plate?
Black air.
Black, absolutely. Because air cannot be absorbing the X-rays. So all the X-rays which are passing through the lungs will be carried to the back side. So the lungs will appear blackish in color because of the presence of the air, for example. Okay. So these are the different colors in the X-rays what you are going to see with the different structures. Okay. So this is the reason. X-rays absorption, that will be giving rise to the color of the different structures over the X-ray plate. Getting it out? Right? So this will be asked in the examination. Okay. So, in case of superior extremity concerned over here today. Yeah. So there are few views. What is that? VIEWS. Views. View. Okay, X-ray views. There are few different views in case of superior extremity. One is anteroposterior view. There is no anterior view as such. There is no posterior view as such. Okay. Why? Because if you focus the X-ray, if you pass the X-ray through any structure or any area over here, that will be passing through and will be displaying the image on the X-ray plate. Getting it out? Okay. So the X-rays will be passing through the body and will be displayed on the X-ray plate. Okay. So it is not only the anterior view, not only the posterior view, it's anterior-posterior view. Getting it out? Anteroposterior view means the X-rays will be thrown from the anterior aspect and the X-ray plate will be kept on the posterior aspect. So that is anterior-posterior view. The reverse, posterior-anterior view, absolutely. The X-rays are focused from backwards, from posterior towards the anterior direction. So the X-rays will be hitting on the back and the plate will be kept on the front. Getting it out? That is called the posterior-anterior view. Okay. There are other views called lateral view and oblique view. Okay, for example, there is a fracture of the radius over here. For example, there is a Colles fracture. Okay. So if you see in anteroposterior direction, this is the anterior aspect, this is the posterior aspect. So if you see, the fracture might not be visible because it is displayed on the posterior aspect. Okay. But if you take it on the lateral aspect, in the anteroposterior view, you may not see the fracture fragment over here. Because even the mild fracture also will be displaced on the posterior aspect in case of Colles fracture, mild fracture also. So if you want to see that elevation of the fracture fragment, you have to take it on lateral view. So you can see the elevation of this fragment over the lateral view now. Okay. So for the lateral view, it will be focused from side to side. So that is purely lateral in aspect. Getting it on? Even though it is focused from the medial to lateral direction, it is termed as lateral view alone. Getting it on? Right? And one more view is the oblique view. Okay. This is a hand, for example. So this is the anteroposterior view. X-rays are passing from this side, it will be passing through the hand and will be focusing on the X-ray plate on the posterior aspect over here, right? So this is the anteroposterior view and this will be lateral view. Is it not? This is the lateral aspect. Towards the thumb is the lateral aspect, right? if I put on the X-rays in this way, what drawback will happen over here? What drawback it will give? What for we are doing the X-rays in case of superior extremity? For seeing the fractures. Isn't it all right? For seeing the fractures. Okay, mainly for seeing the fractures. Okay. So if I put it in lateral view, the entire hand, what will happen? For example, there is a fracture in the third metacarpal. So if you take the anteroposterior view, you may see to some extent the fracture fragment, but on the lateral view,
We can't see.
what will happen? Why you can't see?
We can't see.
No overlap.
Absolutely. So I have told you that there will be third metacarpal fracture over here.
I thought.
So obviously,
Second
if you
day
keep it
गाड़ी
like this in this manner, the first, of course, the first phalanges over here, the thumb phalanges, and then followed by the second
Second.
metacarpal will be obstructing or overlapping the view of the third metacarpal over here. So there will be overlap of the image over here. Getting it now? So that's why we'll be taking in oblique manner. So everything will be displayed in case of oblique view. Okay, right? So let us see all these views. What are the three views? I have told you. Sorry, four views.
Anterior.
And oblique view.
Okay. In case to see the fractures, generally we will be using anteroposterior view. For example, a patient is brought to the casualty through traffic accident. He can't able to sit down. He will be lying down only. Generally, you would have seen the casualties, right? So in that case, you will be taking the X-rays from the bedside. Okay, you will be keeping the X-ray plate over here, and you will be focusing the X-rays from above downwards. So it is most probably the anteroposterior view. Is it not? Right? So patient can't able to get up. For example, there is a fractures of the femur and humerus also, for example. Okay, the patient can't able to sit. That patient can't able to stand also. Okay, so the patient will be lying on the bed. You will be taking the X-ray machine over here, and the X-ray plate will be kept underneath, so that you can focus the X-rays from anterior to posterior direction in lying posture. Do you able to understand? So most of these X-rays will be taken in anteroposterior direction rather than the posterior-anterior direction. Okay. In case of thorax, there is a must X-ray nothing but the posterior-anterior view. What is the reason? It will be done during the thorax, what is it?
Thorax radiology.
Thorax radiology, absolutely. Okay. So here we are mostly focusing on anteroposterior view, lateral view, and oblique views. Okay. First of all, let us see all the way from shoulder joint, because we are concerned all the way from shoulder till the distal phalanges over here. Right. First of all, let us see the shoulder joint. So in any given X-ray, you are supposed to describe it in this manner. Okay. So the color coding, which structure will be giving rise to which color, and then followed by what are the views, and then followed by which region you are supposed to say. Okay. So for example, the X-ray is given in this manner. So everything is focused over here, isn't it? See here, part of the thorax is focused over here, and shoulder joint is focused over here, and then of course the entire arm and part of the forearm, and of course the elbow is focused over here. So how to describe it? Okay. To describe an X-ray, you have to first of all identify the region. How to identify the region? Out of the entire X-ray, the middlemost portion, what is it focusing on, is the main part of the X-ray. These are the extra parts over here. Okay, generally, in case of X-rays, one joint above, one joint below will be taken. For example, this is the X-ray of arm, for example. Okay, so the entire arm is focused over here, along with shoulder joint above and elbow joint below. These other structures may be involved or may not be involved. Okay, that is the concern over here. We are concerned only with the arm over here. So always whenever an X-ray plate is given like this, just focus on the central portion. You know, the central portion, what is focusing over here, that is the description of an X-ray. So if the examiner gives me this X-ray plate, so how I will describe? Okay, it's a plain X-ray. Okay, plain X-ray. Plain X-ray, there are two types of X-rays. One is plain X-ray and one is contrast X-ray. Contrast means whenever you inject a dye. Okay, for example, if you want to see how the blood circulation within the particular segment of an aorta or any artery, whatever it may be. So you'll be injecting a dye. If the dye is getting obstructed, that gives the actual image of obstruction. The rest of the part of the artery will not be displayed. Only the part which is getting the dye or which is carrying the dye will be displayed in the X-ray. So in that manner, we'll be using the contrast. Few dyes will be there, like iodine dye and all those things. So in case of X-rays, we'll be using certain dyes. So if you are using a dye in any X-ray, that is called the contrast And if you don't use any dye, and if you are directly taking as such, that is called the plain X-ray. Plain dosa, masala dosa, right? So plain dosa, nothing will be added. Masala dosa will giving some masala, right? So we are here giving the masala, nothing but the dye over here. Got it or not? Everybody had dosa or not?
No.
Really? That's good. I know South Indian, so you can understand, right? Okay, fine. Let's see. Okay. So it's a plain X-ray. Anterior posterior view. Why it is anterior posterior? I'll be discussing that later. And it's a region of arm. Okay, it's a plain X-ray, anterior posterior view, and arm region. Okay, and which sided it will be written on the X-ray. Okay, for example, if it is not written over here, you can't understand whether it belongs to the right side or left side. Because, for example, if you have become a radiologist, for example, okay, or any anesthetist or whatever might be, okay, or orthopedician, for example, okay. So X-rays will be, you will be writing the X-ray of arm, right arm, and you will be sending to the X-ray lab, whatever it might be. Okay. So there they will be taking the X-ray and they will be sending back. So if they do not denote this L or R, you can't understand to which side the X-ray technician has taken an X-ray. Getting it out? Because all the time you will not be going to the X-ray technician and will be asking on which side you have taken, right? So for that sake, this L. So L means left side. If it is written as R, then it will be right side. Okay. So it's a plain X-ray. Anterior posterior view of left arm is a description of the X-ray. Getting it out? So whenever an X-ray is given, it's a plain X-ray, no contrast is used, and then anterior posterior view, and then of left arm is a description. Okay, what's the region, whether dye is used or not, and which view. Okay, is the description of an X-ray. Okay, let us see from above downwards. Okay, first of all, we are focusing on the arm. Okay, this is the plain X-ray of left arm over here. Okay, but we'll see the other structures right from above downwards. So this bone is nothing but the clavicle, you can understand. Okay, so you can see the lateral border of the scapula over here. Right, this is the lateral border of the scapula, and this part is the glenoid cavity. Is it wrong? And what is this thing? The medial 2/3 and medial 3/4 and lateral 1/4, the junction. Below that will be the coracoid process. Okay. And what is this one? Spine. And this will be acromial process. See properly over here. Focus over here. You can see a gap is in between the lateral end of the clavicle and the acromial process over here. Could you even understand? Could you see that? It is not the fracture over here. It is basically a natural anatomical gap. How it would have happened over there. You can see there is a small gap in between the head of the humerus and the glenoid cavity also. It is not sealed over here. What might be the reason?
Synovial fluid. Synovial fluid. Synovial fluid.
Synovial fluid. It's just a fluid. Imagine that there is a fat over here. Okay, so there is a fat. Obviously there will be fat and muscles over here. Is it not? So that is not the main thing. Synovial fluid is a very slightest thing. It's not like it will be separating two structures. Capsule will be around. Capsule will be around. Could you able to see the capsule over here? Could you able to see the capsule over here? No. No chance. It's not a capsule. Not bursa? Absolutely.
Articular?
The articular disc will be present in between the lateral end of the clavicle and the tip of the acromial process. There will be an articular disc over here. And there will be one more ligament over here that is nothing but the acromioclavicular ligament. So those two structures will be separating these two bones over here. Can you get on it? It is not absolutely getting separated. It is because of the presence of the articular disc and the acromioclavicular ligament. It is appearing like as if the bones got separated. Got it on? Because the fibrous tissue over here and the capsule over here will be less absorbing the X-rays and will be transmitting the rest of the majority of the X-rays. Getting it on? So anywhere you can't see the cartilage over here. Here there is a cartilage in the road, right? There is a cartilage in the shoulder joint. Is it alright? Right? So there is a fibrous cartilage over here, nothing but the fibrous tissue, nothing but the articular disc over here. That will be obstructing the articulation between the acromial process and the clavicle over here. So that's why the cartilage can't be displayed over here because of the X-rays passing through and through. So that's why it appears like a gap over here. Getting it out, right? And then followed by, you can see there is a glenoid labrum will be there over here. That will be separating the head of the humerus from the glenoid cavity. But that will be holding them together, right? But it appears like as if it is getting separated from the glenoid cavity because of the presence of the glenoid labrum and of course the hyaline cartilage over there. Got it or not? Right? So then followed by this part is head of the humerus and this one is not.
Get tubercle.
This is the head of the humerus. This will be the neck of the humerus. And what is this part?
Greater tubercle.
Lesser tubercle and this part is
Greater tubercle.
greater tubercle over here. Okay. And whenever this upper end is narrowing down over here, this part is
Surgical net. Surgical net.
morphological and water kind. Neck and then followed with the shaft. Is it alright? And you can see because it is on the left side, this part will be the ulnar side and this part is the radial side. So this is
Medial epicondyle.
and this fossa is
Olicon.
oliculated fossa and this one is trochlea and this one is
Capsule.
Okay. And there is an elevation of the lateral aspect. What that elevation might be? Deltoid tuberosity on which this deltoid muscle is inserted. This is the muscle over here. This
Yes sir.
is getting inserted over the deltoid. Okay.
বোঝা যাচ্ছে
And
মোটামুটি
the outermost structure, this part is the skin over here. Whatever you are seeing, this part is the skin. Could you understand?
Yes sir.
This part is the muscle. Could you understand? Skin is very much
ফোনে ভালো
thinner
বোঝা
than the
যাচ্ছে না
muscle. Right? So muscle will be a bit more whitish in color compared to the skin over here. Right? Okay. And then followed by this is the coronoid process of the ulna and this is the
Radial head.
This is the radial head and this part is this belongs to the radius. Both bones are getting overlapped over here. That's why you can see a whitish image over here. Getting it out? So this part is the radial tuberosity. Getting it out? And this is the lateral border of the scapula. Medial border is not focused over here properly. Okay. And these are the ribs. You can see that. And these are the intercostal spaces. And you can see the lungs are appearing blackish in color. Could you able to see that? These are the lungs which are appearing blackish in color. And bones are appearing whitish in color. Okay.